Before you approach the animal, you assess your own safety, which means that you need to assess the demeanor of the patient first. While you're doing that, you can also check for respiration, or if you see any gross abnormalities, like runny nose or eye discharge. When you assess that the animal seems to be friendly and approachable, you call the animal's name. This dog is Amy. Hi Amy, how are you? And you assess if the animal is friendly of you to be approached. This dog seems to be very friendly. When you assess an animal on the table, especially if the animal seems to be a little bit scared or uncomfortable with being in this situation, it helps to have just a couple of treats there to make friends with the animal and make it feel comfortable with the situation. We start by assessing the nose. We look for symmetry, so we look that the nostrils are asymmetrical, the nose is symmetrical, that there is no discharge and no injuries. That's all clear here. As next, we're going to assess the eyes. We do that by pulling the upper lid up and the lower lid down and having a look at the conjunctiva of the eye. They should be nice and pink like they are here. We have checked that there are no injuries of the cornea and no foreign objects, that there's no discharge and that they're nice and clear, and that you can see the pupil quite nice and clear. Next, we're going to assess the ears. If you have fluffy ears like Amy has here, you will need to make sure that you actually can see the ear channel, which means that you need to take away the hair and actually look at the ear channel itself. So when you open the ear channel like that, you can have a look that there's no discharge in there. Have a smell that it smells nice and fresh. Have as well a look at the skin here. It should be a little bit pink like here, but not red, not swollen and not thick, which would indicate that there is an infection going on in this ear. You do that with both sides. Take the hair away so that you can actually look at the ear channel. Have a look at the ear channel, have a smell, and have a look at the earlobe itself. This is all fine here. Very good, Amy. As next, you're gonna have access to the mouse. Obviously, this is safety dependent, and if you are scared of the animal or it's wearing a mouse guard, you obviously can't actually assess the mouse. If you have a friendly animal like that, you can just take the lips away. Don't actually open the mouse. Just take the lips away and have a look and check for tartar, missing teeth, broken teeth, a bad smell. And while you're doing that, have a look at the mucosal membranes as well. They should be nice and pink like Amy's are, not inflamed and red or not pale. When you're doing this as well, you can access the capillary refill time. You do that by just pushing just above the canine until the flesh gets white, and you count the seconds until it becomes pink again. That should be no less than 2 seconds. Okay. Very good girl, Amy. Very good. And you do that from both sides. You check that the teeth are healthy, tartar build-up, no broken teeth or anything else. As next steps, you're going to have a look into the oral cavity. You do that by opening the mouth and having a look if you see any tumors or injuries or foreign objects in there. By that, you're just grabbing the animal behind the canines, open the tongue, open the mouth and having a look inside. If that is all okay, we have finished with the examination of the head. Okay.